welcome back to Perio-Implant Pearls, a webcast done by the Maryland Center for Periodontics and Dental Implants. I'm Megan, and with me tonight is Dr. Martin Leybovich, board-certified periodontist. Dr. Leybovich, last week you shared a really interesting dental implant case study, so thank you again for being here today.
Megan, thanks so much for putting all this together. I guess this is our the second time that we're doing this, and we're kind of excited to be here and talk to you and be able to communicate with you via this webcast. It's really just something that, again, always requires a lot of effort, and thanks so much for putting this together.
Great, and speaking of exciting, last week we dropped some very important news on a big project that our team's working on. Any update, Dr. Leybovich?
Yes, Megan. So we are very excited to announce that most likely within the next month, we will be moving to a brand new location that is state-of-the-art. We're hoping to start seeing patients there sometime next month, and we'll definitely be reaching out to everybody, both our patients as well as our referring doctors, about the move. And we're just really excited. It's going to be a totally different experience for everybody, we're hoping that it will just help everybody out on another level.
Great. And in addition, you're about to embark on quite the journey yourself as you cross the world's greatest finish line in partnership with Bike for Kai. Care to share?
Yeah, so this is something, it's my second time doing this, and it's really exciting. Thursday, August 13th, I will be riding 100 miles and going to starting from a place in Mount Vernon, New Jersey, going up to Gillespie, New York, and back, 100 miles in total, in dedication to an organization that works with children with cancer and other debilitating illnesses. And part of that is fundraising for this organization as well. It's been really amazing. I did it last year. Last year I raised over $15,000. I got a week left. We're over $18,000 this year. Hoping to bring it over 20,000 if whoever's listening and wants to contribute and help me get over 20,000. That'd be pretty cool. I've got some of you have already chipped in and helped out. Some of our patients have helped out. Really been an amazing experience, and looking forward to getting to that $20,000 goal of fundraising, as well as to the actual ride. I mean, it's been a lot of work and effort over the last several months.
To find out more or to donate, you can click the links found below. And actually, speaking of hot topics, today's topic is aesthetic crown lengthening. Now, Dr. Leybovich, can you tell me what brings patients into our office for that treatment?
So generally, it's a patient with short clinical crowns or a very gummy smile, and their anterior teeth seem very short to them, and they want to make them longer. A lot of these cases, though, have been coming lately where a gingivectomy has been performed already. And a gingivectomy just eliminates the gum tissue. And one of the things to discuss is that how to properly diagnose this case, because what's going to happen if it's just a gingivectomy, meaning just gum tissue is removed, the gum tissue will simply just grow back.
I imagine that has to be quite frustrating for the patient to deal with that regrowth. Why does this occur?
So it's kind of relatively simple to understand. There's a concept called biologic width, okay? And biologic width is a natural phenomenon where the tissue has to be at least 3 millimeters coronal of the crust of bone around the tooth. So that accounts for, why do we say 3 millimeters? Because that accounts for the connective tissue attachment, which is 1 millimeter, the junctional epithelium, which is another millimeter, and then the sulcus, which is another millimeter at least, sometimes longer. And so we need to account for at least that amount of gum tissue. So if you just take and remove just gum tissue, what's going to happen? That's going to have to recreate itself and just grow back. So you could do all the gingivectomy in the world, right, with every instrument, whether it's a blade or a laser or whatever it is, and the tissue will just simply grow back. It'll just take a little bit of time, but that's what's going to happen. So, so the proper way to treat these cases is through crown lengthening, which is essentially removing some of the underlying bone. It sounds really bad, but it's really not a major procedure. It's not bad at all. How does this happen, right? The cause of this most of the time is what's called altered passive eruption. So let me explain that, okay? When a tooth erupts in the mouth, it actively erupts and it starts to come out and it will hit the opposing tooth. That is active eruption, okay? Once it hits the opposing tooth, active eruption stops. What happens after that is the tooth is still actually erupting, but what's happening is the bone is actually moving away, okay? And as the bone is moving away, the tooth is getting longer. When that is called passive eruption. When that passive eruption is altered, we call it altered passive eruption, meaning what? The bone is not moving back away, the tooth is not getting longer the way it's supposed to be, so now the tooth looks longer. The outcome of that is a short tooth. And then if you do a gingivectomy, then it's just going to stay short. You may lose some tissue temporarily, but it's all going to come back. And so the proper way to do that is by just shaving down a little bit of bone. We want to be very careful, make sure you're not more than 2-3 millimeters away from the bone, from the CJ. But that's the proper way to go through this.
Yeah, sounds like diagnosis is very important here when it comes to solving these cases. So how do you ensure a proper diagnosis?
So that's a very good question, Megan. The way to diagnose this properly is simply by looking at a radiograph. If it's an anterior tooth, we look at the periapical radiograph and we see where the bone levels are. If the bone level is at the level of the CEJ, right, then we know that's when we have a problem, or slightly even apical, meaning we want to have a good 2 to 3 millimeters of bone apical to the CEJ. And you want to look at, you also want to, when you do that, you want to very carefully look at the CEJ on the buccal and facial side, which you can't really see on the radiograph, but you can kind of make out a little bit if you're very careful in diagnosing. And draw the little hyperbola that you would see along the CEJ of the tooth. You kind of look at that on the X-ray so you can properly diagnose. If you see that CEJ, that hyperbola, is really embedded in bone, okay, that's when you know you have a problem. And that's essentially what you would have to use to diagnose these particular cases.
So now you've identified a patient who needs to undergo aesthetic crown lengthening. Can you go through the procedure a little bit for me?
Sure, Megan. So the first thing that you want to do is you want to look at the tooth very carefully and kind of have an idea of where the CEJ is on the facial aspect of the tooth. And you can do that with a periodontal probe. Identify where the CEJ is by just probing down, okay? And then once you probe down, you can have an idea of where it is, and then you make a mark with another probe as to where that point is. You want to do it in the center of the tooth. That kind of gives you an idea of where the length of that tooth is going to go. Once you have that, you kind of follow the CEJ and gradually just incise and make an incision around the tooth. And you usually start with tooth number 8 or 9, okay? Whichever one you start with, right, you want to make the next one right next to it, whether it's 8. If you start with 8, you want to make 9 look exactly like 8. Once you do that, you keep going further back. You make the incisions further back and 7 and 10. Now the gingival zenith of 7 and 10 will have to be slightly more coronal than 8 or 9. That's just a natural aesthetic appearance, and that's where the CEJ is of those adjacent teeth. When you go from one tooth to the next, one of the techniques used, which I use, is you don't have to necessarily make the incision all the way up to the papilla. You can make what's called the papilla preservation incision, where you keep your papilla, and it actually makes it a lot easier to suture later on. And that way you maintain the papilla and you avoid any potential black triangles later on. So now you go from, you started with 8 and 9, then you go to 7 and 10, and you go to 6 to 11. The gingival zenith of 6 and 11 will be at the same level of 8 and 9, essentially. So that is what we want from an ideal aesthetic appearance, and that's basically what you're looking to do. Once you have that, you make those incisions, you flap the tissue, you remove the collar of tissue that stays there. You carefully evaluate the distance of the bone to the CEJ. You don't want to be more than 2 to 3 millimeters away. You want to make sure everything is nice and even. And once you remove the bone, you suture the flap back. You have a flap now, so you suture the flap back to those papilla preservation to those papilla that you have that you've preserved already. And so that is basically what you're going to do to put everything back together, and you'll see it really comes out really nicely.
So, Dr. Leybovich, something that I noticed is that some individuals use a gauge in order to get the most aesthetically pleasing result when it comes to redesigning the gum line. Can you tell me a little bit more about that?
Sure. So Stephen Chu is a prosthodontist who developed this. It's called Chu's gauge. He talks about the length to width ratio, or should I say the width to length ratio, which you want it to be at 78%. You want the width of the tooth to be 78% of the length of the tooth. And that way, that is the most ideal, aesthetic result. And so when doing these procedures, you could actually use these gauges to make sure that the measurement of the width to the length is at these ideal proportions.
So, Dr. Leybovich, something that I've heard is that when it comes to gingivectomies as well as aesthetic crown lengthening procedures, one of the biggest challenge proposed to dentists is the issue of suturing back up that gingiva. Now, I know we talked about making conservative cuts. However, are there any other tips and tricks that you have in order to overcome that challenge?
It's a great point, Megan. I definitely try to be as conservative as we can by making those conservative incisions in the beginning. When you do those, it makes it very easy to suture. Just a simple interrupted suture is all that's necessary. However, there are times certainly where it is more difficult to suture, where you don't have the tissue exactly where you want it. Sometimes, such as a sling suture that wraps around the tooth is necessary, and sometimes other techniques. It's all about the experience that you have in suturing. The more experience you have in suturing, the different techniques that are out there, and the different techniques that move tissue in different ways, the easier this is going to go. I mean, that's true in general for surgery, but when dealing with these cosmetic cases, it is definitely very, very important for you to be very familiar and very fluent in different suturing techniques, so that if there is something that isn't positioned exactly where you want it, you know the technique and familiar and experienced with technique to be able to suture it properly. I do believe that that's super important to be able to have that experience in suturing.
Yeah. Now that we've gone through the whole procedure itself, can you tell me a little bit about the healing process and what patients normally experience when they undergo these procedures?
Sure, Megan. So the healing really isn't too bad. You know, within a day or so, there is some redness, but all of that pretty much stops within a day or two, and very often when this redness is noticed by the patient, they get a little bit nervous, and very often you get a call back saying, hey, I'm seeing this and that, but usually it's fine. Within a few days later, probably a week later, things look even better. When you see them for their first post-operative visit at 2 weeks, it usually looks pretty good. And then we see them, at least what we do here, is we see them 4 weeks later, which is 6 weeks from the time of the procedure, and then we've got a pretty good idea of what everything looks like. Now, in terms of restoring these cases, if there's any restorative work that needs to be done, be it veneers or full coverage crowns, we want to wait at least 3 months for the anterior region. That's not true for posterior teeth, or where cosmetics is not a concern. But where you are concerned with cosmetics, it is very important to wait longer. We wait 3 months before we allow for those teeth to be restored. There are studies that show to wait up to 6 months. However, we know the patients are usually very anxious to get these done. Most of the restoring docs are very anxious to restore these. So generally 3 months is a good number for us to say okay to restore these cases.
Yeah, and I actually see that we've recently done an aesthetic crown lengthening procedure here in the office. You want to tell me a little bit more about that patient?
Sure, Megan. So a young lady came in, and she was just working from home now, like everyone else is except for us. She was for the longest time very troubled by her short clinical crowns. We carefully diagnosed the case, explained to her the situation, explained to her that, hey, this is a altered passive eruption problem, and we followed the protocol, and lo and behold, even just a couple of millimeters, all we had to do was remove just 2 millimeters. And it sounds like very little, but it makes such a major difference in the appearance of that. And she was just so happy. One of the things that she mentioned was is that she only wanted to do the front 6 teeth, 6 through 11. And I said to her, that's fine, but let me just talk to you a little bit. And I explained to her, hey, if you just do 6 through 11, your teeth, your premolar teeth right behind it, number 5 and number 12, are very short. You're going to have a very drastic difference in teeth size and tooth size when you go from one to the next. And when you smile, it's going to be very noticeable. And it was noticeable. If we just include that one additional tooth, the first premolar, it would make a major difference as to the overall appearance, because now you at least have a certain blend with even the next premolar, with the second premolar, and it kind of really comes out really, really nice. And the outcome was really nice, and the patient was really happy.
Great. I mean, it's an important fact to point out. I feel like a lot of patients are focused on fixing only one area of their teeth, and they forget to focus on how fixing that problem will affect other teeth. And so we actually have here the before and after photos of that crown lengthening case. You can see the drastic difference that is made by those few millimeters. Another great job, Dr. Leybovich. And you can always see our before and after photos on our website at www.mdperio-implantcenter.com. And you can always reach out to us with questions or comments through our Facebook, Instagram, or our email. Any words before we sign off, Dr. Leybovich?
I just wanted to say thanks so much for putting this together, Megan. Good job as always. And we just were very excited about this new location. It's really something that is really going to change the way our practice runs and functions, and we really hope that you can take a part of that. We'd love to put together some huge grand opening at one point or another, but just right now we're limited given the circumstances. We thought that Maryland was improving, and we thought that we might even be able to get away with something, but we are definitely looking to put something together, and we'll definitely let you know about it. I think that that's that, and just if anybody's able to help out with the Bike for Chai or ride that I'm doing, that would be super appreciated. We're trying to reach 20K, we're over 18, and that's basically it. And thank you so much for watching and listening, and we'll see you next time.